Federal shutdown drags on into a fourth week. The term extending health care subsidies, as we just mentioned, it's been thrown around a lot.
Yeah, but what does that actually mean for you and the coverage that you are paying for? Arman Rahman breaks down the numbers to find out.
Well, during COVID-19 pandemic, President Joe Biden signed into law subsidies for those under the Affordable Care Act, or Obamacare, in the form of tax credits to make health care more affordable for millions of Americans. Democrats won't sign a deal to fund the government unless those tax credits, which are set to expire at the end of the year, are extended. Now, even though you're hearing that word subsidies a lot, it has all to do with premiums, or the monthly fee you pay for health insurance coverage. About 24 million people across the country are enrolled in Obamacare plans, in large part due to these subsidies, which can eliminate premiums for low-income enrollees or cap them for high earners. In Wisconsin, more than 313,000 people signed up for an Obamacare plan last year, and almost 90% of them received an advanced premium tax credit, the subsidy at risk here. Now, according to the Kaiser Foundation, Obamacare marketplace enrollees would see out-of-pocket costs more than double without subsidies.
For some people, we're talking about premium increases of thousands of dollars a year. For them, it's very likely going to be unaffordable. For other people who, especially are lower income, the hit is going to be more like hundreds of dollars a year. Of course, if you are making $30,000 a year, another few $100s a year can be quite difficult.
And as I said, according to the Kaiser Foundation, some of those enrollees could see that out-of-pocket costs more than doubled. And I spoke to the manager of the health insurance store in Middleton, which offers free consultation and helps people shop the marketplace for insurance. He could not do an interview because it's the middle of Medicare open enrollment, but he says the subsidies have been helpful and losing them would be, quote, an absolute nightmare for many of his clients. So what should you do if you're worried about your Affordable Care Act costing more next year? Sachs has some tips that I'll share tonight at 6.